Wise Rehabilitation Hospital, because it's the only one.
That's right. We're the only acute inpatient medical rehabilitation facility in the state.
And what drives us here today, we'll talk about it later, is that the hospital won an award that is worth talking about. It's in the top 1% of such hospitals in the country. That is something. But first, let's understand, what it is. What is a rehabilitation hospital?
Well, let me just give you a brief summary. We're a specialty hospital, and our focus is on treating patients who have survived what have been catastrophic injuries or illness. So some of our patients have survived motor vehicle accidents, falls, industrial accidents. Others have survived very severe illnesses, all of which, though, have left them with some type of impairment in their function that's caused them to become disabled.
But which can be rehabilitated.
And even more so nowadays than in the past, with medical technology advancing and patients surviving things that would have killed them in the past. We're finding patients with very complicated conditions, but who want to return home, who should be able to return home. And so we work with these patients in a very comprehensive way to enable them to return to home and their family and to a productive, active life.
So this is not a hospice or a hospital that you go to die.
Oh, no.
This is a hospital you go to be rehabilitated and return home.
That's right. The process itself is it's very involved, it's very intensive. So we are purposefully looking for our patients who are able to participate in 3 hours of intensive therapy every day.
This can be very challenging, time-consuming, a lot of effort involved in that much rehabilitation.
Oh, it's difficult. We see some of our patients, just think of how difficult it would be if you lost the ability to swallow, which is a very common condition that we deal with. Patients who've lost the ability to walk, lost the ability to simply get in and out of the bed, to dress themselves in the morning. These very fundamental activities that people participate on a daily basis, and then all of a sudden they've lost the ability to do that. So it can be very challenging working with our patients, helping them to relearn some of these basic skills so that they're going to be able to return back home and to care for themselves and to function as productive and happy citizens out in the community.
So inherent in all this is rehabilitation therapists of multiple disciplines, yeah?
Yes.
What kind of, do you have them on staff? Do you call them in from outside? What kind of therapists do you have?
Yeah, we have roughly 70 licensed therapists working in our hospital. Physical therapists, occupational therapists, speech therapists, recreation therapists. They're involved very intensely in working with our patients. They're all very specialized in working with patients who've had this degree of severe injury. So it's a very specialized type of care that they provide, and it is very intensive, it's very involved. We really have to look at our patients holistically, try to determine everything that they need to accomplish in order to return home, and then we have to accomplish them.
Yeah, and sometimes it's complicated because it's one thing affects the other thing, holistic, the whole body is involved.
That's right.
Somehow.
That's right. Some patients may, for instance, if they've had a stroke or a brain injury, they may have impairments of their memory, of their ability to process thoughts, to solve problems. Other patients, for instance, patients who've had amputations, they are perfectly cognitively intact, but they've lost the use of their limbs. And so we have to be able to address the challenges of all these patients. Because our goal is that regardless of the type of injury that they've had, that we can provide them with the therapy they need and that we can return them to home.
Yeah. Well, so how long is the average stay of a patient who's had a traumatic experience like this? I know it's a hard question, but what on the average do you expect the stay would be?
I think right now we're running at around 12 and a half days, so it's around 12 to 14 days on average. For some patients, we do work with patients who've had orthopedic, surgeries or injuries such as hip fractures and joint replacement. So they're more on the shorter end of the scale. We also work with patients who've had very severe spinal cord injuries, and they're typically very complex, and so they may stay at our hospital for longer than a month. It's very individualistic, and it really depends on how many of these challenges we have to address during their stay.
What about doctors? You have doctors on staff?
Oh, sure. We, as an acute care hospital, We provide full inpatient medical services. So we have a full staff of doctors. We have physician staffing, 24/7, 365, as we would at any hospital. Our primary medical staff consists of specialists in physical medicine and rehabilitation. So they are specially trained, particularly to deal with patients who have this type of problem. We also have 24-hour nurse staffing with a large core of RNs who are specialty trained and have special experience in working with these types of patients as well. These patients, they have medical conditions. Either their injury came about as a result of a medical condition or they developed medical conditions because of the injury. And we need to address all of those factors of the patient in order to ensure that we get the outcomes that we want our patients to have.
So if there's a heavier staffing issue with the 24 hours a day, and why is that? Why do the patients in the Rehabilitation Hospital in Pacific need 24 hours a day?
Well, many of them have very complex medical problems. For instance, with our amputee patients, the patients who become amputees, it's because oftentimes of severe diabetes. They oftentimes have also, severe renal disease, and they may be on hemodialysis. Some of our patients have survived very long stays in the intensive care units, and so they may come to us with tracheostomies. They may have a lot of residual heart and lung problems, and so we're asking them to do a lot of physical activity at the same time. And so it's very challenging, particularly in the first the few days after they're coming from the acute care hospitals. They may be coming from the intensive care unit where they were immobilized on a ventilator, and then within a few days we're asking them to get up and start walking, start climbing stairs, start dressing themselves, what have you. So we need to make sure that we can manage their medical problems at the same time that we're trying to address these other rehabilitative issues.
So these are very stressful injuries, and they're certainly just disruptive. What role does psychology play in this rehabilitation, or psychiatry? Do you have people on staff for that? How do you deal with that?
We do. We work quite a bit in regards to our patients' psychological status. These types of injuries, they really are catastrophic. We oftentimes will have...
Catastrophic means what? It's not life-threatening, but it takes away your function.
Well, these injuries many times were life-threatening. The patients survive them. And, particularly nowadays with medical technology, 20 years ago, these injuries may have killed these patients, but now they're coming to us having survived them and then having to overcome them. Catastrophic in that we can have people who were the primary caregivers for their family, primary breadwinners for their family. Their families are dependent on them, and then they have some type of injury, a brain injury, a spinal cord injury, and now they find themselves that they are dependent. It is a life-changing type of event.
For them and the family.
For them, for the family, there are family issues, there are financial issues that go into play, and the patients are aware of this and they know this, from day one. And so we need to address those as well, trying to solve these problems. And so we need to work with our patients. We need to restore to them a sense of normalcy, a sense of purpose, so that they can resume a productive life.
So you want to put them in a frame of mind where they can achieve a return home and a relatively normal life. And so it's not just a physical thing at all. They got to believe in it. They got to have confidence that they can do it.
It's a very holistic thing. We want our patients to live happy and productive lives when they leave us, even if they have some residual disability that they may need to live with the rest of their lives. We have many patients who have gone on and achieved incredible things after rehabilitation. Injuries that that if you were to think, well, if I were to experience that injury, I would think my life was over. And yet you see these people, they survive these injuries and they improve themselves. They go on and live productive and oftentimes incredible lives, doing things that they perhaps never even thought that they would be able to do themselves.
That's an interesting point, because maybe, and this is certainly a shakeup when you have in your life, when you have a traumatic injury like this.
Oh, sure.
And with the right advice and consultation, with the right psychological approach, you might be able to do things, as you just said, that are beyond anything you've ever conceived you could do.
Right.
And it could have a tremendously good effect. good comes out of bad on someone who could achieve more than he was able to achieve before.
That's correct, in different ways. We, for instance, we have our the Louis Vuitton Creative Arts program, which is an art therapy program, and we have a number of patients who, prior to their injury or their illness, they were never involved in the arts. They never painted, they never sculpted or did ceramics. They initially became involved in the program as a form of therapy, and they go on and they become artists, and we've actually had several professional artists emerge from the program. People who, previous to their injuries, would never have conceived that they could be a professional artist. So it's an amazing, life-changing event for them. That they're, they actually, it's, somewhat of a cliche, but one door is closed and another one opens for them. And so what we do is try to at least guide them in that direction so that they can see that there are other opportunities in life that they can address, and just try to make sure that they have the abilities to address them.
Making miracles, yeah. So you're the only rehabilitation hospital in Hawaii.
That's right.
Are we under or over the norm for American states? In other words, if I went to, based on population, if I went to a state on the mainland, would I find more per capita or less per capita?
Well, it's just like a lot of other areas of healthcare in Hawaii. The utilization of healthcare services across the board in Hawaii is lower than it is in the United States. And that's true of rehabilitation as well.
Is that because we're more healthy?
That perhaps is part of it. There's a lot of different factors that are involved. I think one of the challenges that we face is that finding good providers, whether they're physicians, nurses, therapists. It's tougher here than it is in other parts of the U.S. I have practiced in other parts of the U.S., and if you wanted to recruit a therapist, you could have 5, 6, 7 states that you could be recruiting from. Hawaii, it's more difficult. And so that does...
And you're looking for a higher standard anyway.
A high degree of professional training, a high degree of experience, and also someone who is empathic, who can understand our patients' concerns and their needs, and be able to address them. So we do tend to staff to a very high level. Also, being able to serve the neighbor islands is a challenge. Patients who've had injuries like this can't necessarily get on a plane and come to us. And so trying to meet their needs is something that's been a real challenge. I think the healthcare system as a whole in Hawaii is challenged by that. But we try to rise to that occasion. And I think we do a pretty good job at that.
Can you accommodate all the patients who need your services, or are there patients right now who could use your services but don't have access for one reason or another?
Yeah, the geographic thing is one that
the neighbor islands.
The neighbor islands in particular, and that's just not true for rehab, but for almost every other type of service as well. I also think that there is somewhat of a lack of awareness of the types of care that Rehab Hospital provides, and of the beneficial outcomes that are produced by being able to participate in intensive rehab programs. But we're working to change that. We're really reaching out to the community, trying to explain the benefits, trying to explain how important it is that patients really receive the intensive care that they need, because it does make a difference in regards to their outcome longer term.
Yeah, and thus to the community in general.
Absolutely.
So that's Dr. Tim Rowe. He's the CEO and president of the Rehabilitation Hospital of the Pacific, which is on Kuakini Street. And it's a very important place to know about. We're going to take a short break. We'll be right back. We're going to ask Dr. Rowe about his own training and his own motivation in this matter. It's a special hospital, and he's a special guy. Be right back.
Aloha, welcome to ThinkTech Hawaii. My name is Josh Green. I'm the host of a program called Healthcare in Hawaii. I'm a physician. I work in the emergency department on the Big Island. I also serve in the state senate, which, please don't hold that against me, doesn't detract from my television program. We speak about all the big healthcare issues in the state. We get together on Tuesdays from 2 o'clock till 3 o'clock in the afternoon, and we try to talk about the most important issues in healthcare. This is a terrific venue for people to learn about healthcare. There are many programs on this station. We broadcast it later, not just on the internet, but also on OC16. Thanks for joining us. Please be informed healthcare consumers.
Hi, my name is Seymour Kazimirski. I have a show called Seymour's World on ThinkTech Hawaii. Our show is about opening minds and facilitating conversations. To tell you the truth, I have no idea what we're going to be talking about. I have no idea who our guests are going to be, but I guarantee you we're going to have lots and lots of fun. Aloha from Seymour's World.
Okay, we're back, we're live, we're here, and Community Matters because it does. And we're talking about rehabilitation hospitals. We're talking about Hawaii's Rehabilitation Hospital, which is the Rehabilitation Hospital of the Pacific on Kuakini Street here in Honolulu, with Dr. Tim Rowe. He's the CEO and president of that hospital. And his training is in rehabilitation medicine. Surprise, surprise.
That's right, I've been doing it for about 25 years now. I went to medical school at Loyola University in Chicago, and then went out to the West Coast, did my internship and my residency program in physical medicine and rehabilitation at UCLA, and practiced in various parts of the country. And then family, as it does for many people, brought me back to Hawaii. And so I've been practicing here. I practiced here for several years at Rehab Hospital. And then I joined the board of directors for a period of 4 years. And then in January of 2012, I came in as president and CEO.
Yes, but why?
It is, I think in medicine, of course I'm biased, but I think it is the most gratifying field in medicine that at least that I could have found. One of the things that I really learned early on in my career is that in rehabilitation you are allowed the privilege of watching people who have gone through these catastrophic, life-changing injuries. And rather than giving up, rather than accepting some fate that was thrust on them, they devote themselves to restoring themselves and to essentially earning back the life that they feel that they need with an incredible amount of hard work. Yeah. It is just very life affirming to see people overcome these types of injuries. And then go on and live happy, productive lives again.
But you're the CEO. Does the CEO get down there and make rounds? Does the CEO get down there and practice medicine actively with your patients?
I do make rounds, but I am no longer in active practice. It is a time-consuming job. I still consider myself to be a patient advocate, though. And one of the things I learned as I moved into medical administration is that the patients need a voice in how hospitals are run and how programs are structured. And having worked with patients for a very long time, I feel that I can at least help to develop programs and services that will meet these patients' needs. We also have a lot of providers, the physicians, the nurses, the therapists, and in order for them to be maximally effective at their jobs, there needs to be an understanding of what's required. And so I've found it very satisfying to be able to work at a hospital like Rehab Hospital and develop programs and services that meet the needs of both the patients as well as our providers.
Wow. So, wow. I mean, so you've got to, they say it's like making video is not about video, it's about relationships. Doing real estate is not about real estate, it's about relationships. And it seems to me that you've got your staff and professional issue. If you're a patient advocate, you're advocating to the whole hospital. They should take care of patients in a professional way that meets the standard of care. This is not an easy job because you have a lot of moving parts. No.
Yeah, it's a challenge. There's no question about it. And we're in an era now where healthcare reform is accelerating. And so it takes time to learn those things as well. What does the Affordable Care Act mean? How is it going to be changing healthcare over time? Where does rehab fit into that?
Yeah.
And then being able to communicate that to our staff, because sometimes it can be somewhat confusing with all these changes. And then at the same time, making sure that our patients are getting the care that they need, and making sure that our staff, we have very highly trained, very skilled staff. We want them to be effective at their jobs. And so, how do we set things up? We just are in the tail end of a 3-year, multi-million-dollar renovation project. And a big part of that was to create an environment, a modern healthcare environment that is a superior environment for our patients to recover and a superior environment for our staff to to do their work and to exercise their professional skills at the highest level possible.
With the remodeling, redevelopment of the hospital, how many beds do you have? How many square feet do you cover?
The renovation, well, we have about 125,000 square feet. The renovation was just over half of that, about 65,000 square feet. The building itself was built in stages over a period of time between about 1952 and 1975. So it needed renovation. It needed to be modernized. And so by doing that, it allowed us to bring in the things that a modern hospital needs. We were able to bring in, of course, all the IT support, which modern healthcare requires. We were able to bring in wall medical gases and oxygen, which we did not have before. Helps us to support our care for patients with pulmonary problems. Brought in all new lighting, for instance, which was both energy efficient as well as superior to the old flickering blue fluorescent lights that you would find in old hospitals of the past.
LEDs, yeah.
Yeah, I mean that type of lighting. Yeah, I mean it's there was a lot, but also what it allowed us to do, it allowed us to create an environment that's intentionally not institutional. We used finishes that are hospital grade, but that resemble the kind of finishes. The flooring, the wall coverings, even things like the switches and the plates on the light fixtures that look more like the types of things that you would have at home. Because patients, they don't like seeing stainless steel and linoleum and fluorescent lights. They don't like a lot of noise at night in an unfamiliar environment. They like seeing things that are familiar to them.
This is the modern view, isn't it?
Yes.
Especially when you're trying to get them home and make them feel like they can go home and work toward that.
Right. Our facility really wants to send them a message. You are recovering. You're no longer in an acute care hospital setting. That you're making that next step closer to home. And so we try to create a home-like environment for them, something that looks more like the environment that they're going to be returning to.
Yeah, that's great. So what about this technology? You've mentioned it a few times, and I have a feeling you're exquisitely familiar with it. But you've said, for example, that modern technology changes the way a rehabilitation hospital works. Can you give us some examples of that?
There's examples across the board. For one thing, patients now can survive injuries that even just a few years ago would have resulted in their death. And what that means is those patients come to us with more complex medical needs. And so as medical science has advanced, the skill levels of our staff also have to advance to meet the challenging needs of these patients now. I mean, they're different than they were when I first started practice. So we need to bring in things, like the medical gases and oxygen. We need to be able to utilize things like electronic medical records, where we're able to, accumulate the data about our patients in a much more efficient manner. That's part of it. So there is that challenge of being able to have, for instance, wireless laptops that are on the units that the nurses can access easily, but that are still secure so that they can't be hacked into. So in that regard, the technology enables us to more efficiently treat our patients. And the more time that our patients are spending with the nurses, and the less time our nurses are spending dealing with paperwork or dealing with the IT, that's a good thing for us. But we've also been able to bring in developments in technology that are for patients with certain types of injuries. For instance, one of the devices that we brought in is the Exobionics robotic exoskeleton, which really came.
You got to tell me what that is.
It is, well, if you recall, like in the movie Aliens, the Sigourney Weaver was wearing this heavy lifting suit, and it really sprung out of ideas along those lines.
It makes your limbs move.
It is an exoskeleton that's computer controlled. The wearer will strap it, in this case, to their legs, and it provides the strength and support that they need in order to walk again. It was developed out of research that was done at the Berkeley Bionics Lab, and was initially applied for the U.S. military, and now it is being used to enable people who've had spinal cord injuries that have resulted in paralysis below the waist to walk again. So it's an incredible thing.
But does it, I mean, I suppose this goes for all rehabilitation technology. Does it make the patient dependent on continuing use? Or can you say that, well, we take it off and the patient's better off for not having it, you know what I mean?
Well, there's controversy there, but for the patients who've had this type of injury, they're dependent on equipment for mobility anyway. These are patients who would probably be in some type of a manual wheelchair, and for them, being able to use a device like this, which is still in development stage, it allows them to stand again. And the psychological impact of being able to stand at their full height, looking someone face to face in the eye, is just tremendous. We have had these incredible experiences where family members have watched their loved one use this device for the first time, and it is just heartbreaking when you see the response. That for someone, a loved one who has not been able to walk for perhaps decades, is able to stand and is able to walk. It's still early stages. There's still a lot of development work that needs to be done, but it clearly shows the path that rehabilitation is going, which is utilizing these types of devices so that our patients have fewer and fewer functional limitations as time goes by. It's very exciting.
Sounds very expensive too.
They are very expensive, and that's one of the things. We are working with the company now in the development stage of it, and they're sophisticated devices. They're computer controlled. They use high technology materials. But the ultimate goal is to develop something that can be pulled on and off as easy as you put on a pair of trousers, and that is affordable enough for patients to use every day. And it's not there yet, but we have to put this work in order to get that done. It's a valid goal, and we need to try to see if we can reach it.
Yeah. One more question about the technology is prosthetics, that sort of thing. You must have some practice in that, and I suppose there's new technology in that.
Oh yeah, we're actively involved. I myself am actively involved in the National Science Foundation research project, developing what we believe to be a novel method of prosthetic suspension. There's a lot of exciting things that are coming out of the robotics industry in particular. As these chips get smaller and more powerful, it is starting to really open up avenues that previously would have been inconceivable. Where finally these computer systems are starting to mimic how human neurologic systems work, and that it starts to allow the possibility that at some point these devices can really replace biological functions that have been lost. And we're not there yet, and there's an awful lot of development work that's required. These are very difficult problems that need to be solved, and humans are very complex organisms. But at the same time, being able to use this technology in that way, it really is the future of rehabilitation, and it's a direction that Rehab Hospital is going, full steam ahead.
There's something in the paper about bionics this morning. I was very interested to see that. It's going somewhere.
It is going somewhere, and I think for a lot of reasons, the cost of these systems is coming down. It's becoming better understood how you can use these systems, how you can program them. Things like sensors that can feed into the systems and can help to control them. The cost of those sensors is just plummeting.
It sounds experimental, but it's here now.
It is here now, and it's really just a matter of understanding, how do you make that leap from, some theoretical robotic device to something that humans can wear on a day-to-day basis that will allow them to get up, go to work, drive their car, function in some sort of occupational environment.
Yeah.
And we're not quite there yet, but you can see that path is starting to open itself up. And it's very exciting.
We'll take another break here, and when we come back, I'd like to ask you what the economics are around that, what the economics are around a rehabilitation hospital. That's Dr. Tim Rowe. He's the CEO and president of the Rehabilitation Hospital of the Pacific here on Community Matters, because it does. We're talking about Hawaii's Rehabilitation Hospital. This is it. We'll be right back.
Inspired by an ancient culture, classical Chinese dance, vigorous physicality, timeless stories, 5,000 years of Chinese music and dance, Shenyun presents authentic Chinese culture. Coming to Blaisdell Concert Hall, May 8th and 9th. Tickets at shenyun.com or call 808-792-3919.
Hi, I'm your host on ThinkTech Asia, Bill Sharp. I look forward to you joining us each Monday between 4 and 5 o'clock when we film right here in our studio in downtown Honolulu. The show, ThinkTech Asia, focuses on contemporary events in Asia, and by Asia we mean anything from Hawaii, south to Australia and New Zealand, west to Pakistan, and as far north as the Russian Far East. Clearly, this is one of the most economically dynamic centers of the world, and we bring you up to date on what's going on in a whole host of countries in this very vital region. We look forward to seeing you. Aloha.
Aloha, my name is Paul Jackson, better known as PJ, and my local interest is in sports. I have my own sports radio show at KWAI AM 1080 that you can stream live. I also have my own website, pjsportsradio.com. We have live guests in studio, and we talk about discussions and topics that everyone wants to know locally here on the islands. We cover everything from surfing to basketball to whatever's going on locally, sports-wise. We try to do our best and cover the topics in depth as much as we can. Once again, thank you for joining PJ here on Hawaii Sports Update. Mahalo.
Hi, my name is Andrew Howard. I'm an astronomer at the Institute for Astronomy at the University of Hawaii up in Manoa. I'd like to tell you about the annual open house that we're having. This year it is on April 6th. 11 to 4 p.m. It's an all ages event, kids, grown-ups, even people in between, everyone is welcome. We have a lot of really fun activities. You get to meet astronomers, look at yourself in an infrared camera, play with Legos, make robots, look at videos. You can even make some of the kids like to make comets out of gravel and snow. Even adults like to do that too. You'll be able to look at the sun with a solar camera safely. It's really a great activity. We do this every year in April, and I hope to see you this year. Thanks.
Okay, we're back. We're live. We're here with Dr. Tim Rowe on a given Wednesday afternoon. He's the CEO and president of Rehabilitation Hospital of the Pacific, Hawaii's Rehabilitation Hospital here on Community Matters. So, and we talked about, these new technologies and new, ways to rehabilitate people, costs money. Is there any issue about that getting paid by insurance?
Now, typically these injuries are fully covered by insurance. The insurance companies recognize that if patients don't receive the rehabilitation they need, that they have the risk of being institutionalized long term. And that is obviously not desirable from any standpoint, financial, from a community standpoint. Just in terms of the structure of a civil society. And so, the insurance covers this type of treatment. I wish it was less complicated, but at the same time, we work with our patients to make sure that we get the coverage that they need in order to receive the services that they need.
So it's a collaborative effort that way.
It really is.
Yeah.
It really is. And, particularly, with the Affordable Care Act, with the expansion of insurance and Medicaid and what have you, we're finding fewer of our patients are running into the kind of difficulties that they may have in the past as far as insurance is concerned.
It does raise, your discussion does raise a concern in my mind that if I can't get in to the rehabilitation hospital, and there's only one, then I'm left with much less attractive options, and I'm going to have to be in long-term care. I'm not going to be able to return to my daily functionality. So it's, as a matter of public policy, it's really important that I have access to what you offer.
Well, I agree. We do have some very good skilled nursing and long-term care facilities in the state. Some that do provide therapy services. But the uniqueness of rehab is that we have physician-led treatment teams with specialized staff, nurses, therapists, all of them focused on helping patients recover from these types of injuries. So having access to this type of care is very important. Yeah. And it is complicated. Being able to assemble these teams, being able to have the kind of facility that we need. We have gotten support both at the state and the municipal level in regards to grant and aid that has helped us with our renovation.
Good.
So I think there is a recognition that that the hospital serves a community benefit, that for the patients that really need us, it's necessary for us to be there to keep our doors open. We also have received incredible support from donors in the community. Large donors such as the T.C. Ching Foundation, the Weinberg
Through their
Foundation.
wills and charitable contributions.
And other giving programs, yes.
Yeah.
But also we have a lot of small donors who've also been willing to chip in. A lot of families in town who have supported the hospital for many years and have been willing to stand by the hospital through good times and bad, and make sure that we're able to provide the services that we need.
That's very, very nice, and it makes a statement.
We have a very strong community, both with our patients, with our staff, and then with our donors, working through our Rehab Foundation, all chipping in because everyone there understands how important it is that the needs of these people are met.
Before we go into the last thing I'd like to discuss, which is where it fits, in the bell curve, where it fits in the community of Hawaii going forward. I'd like to just get into your award. So you were given a national award where you were found in the top 1%. That is well, you tell me how it works.
Well, how it works, we participate in a system called the Uniform Data System for Medical Rehabilitation. It consists of around 750 to 800 hospitals each year. They systematically collect information, data on our patients. We submit data on each patient regarding their clinical outcomes. And then this system compares us to all of our peers across the country. And last year, we were ranked in the 97th percentile in regards to our clinical outcomes versus all of our peers across the country. And for this year, we have been ranked in the 99th percentile out of about 780 hospitals. So it puts us in the top 1% of all rehab hospitals in the country, and which I tell my staff, we don't know if we tied with anybody else, and they don't tell us who we ranked up there with, for whatever reason. But I tell my staff that I feel confident that we are one of the top 10 rehab hospitals in the United States based on our clinical outcomes.
That's great, and I'm sure it gives confidence to the people who are referred to you, who I assume are referred to you by physicians in the medical community who know what you do and who feel that their patient, now requires rehabilitation through the Rehabilitation Hospital. Is that what happens?
That's right. There's a real emphasis, growing emphasis these days in terms of outcome and long-term outcomes. And so, the physicians are aware that these long-term outcomes are important, and that the rehab environment presents the environment that the patients need to really achieve the best long-term outcome, particularly for these complicated conditions. And so we have very strong support from physicians in acute care hospitals across the state in working with these types of patients.
So here we are on a bell curve where, because of modern life, modern technology, modern medicine, people are going to live longer. They are living longer.
Absolutely.
It says who died? Lee Kuan Yew died at the age of 91 earlier this week. Right. That is something. But you hear about these deaths in 90 and 100 all the time.
Sure.
Seems like people are living longer. And that means they're going to need you, for the kinds of diseases that need rehabilitation or could benefit by rehabilitation that are age-related in some way. They must be coming to you more now, and you must see more state pressure from that source. And so my question is, where does that fit? Part of the renovation you spoke about earlier, I'm sure part of it is just general update, but the other part is you probably want to be able to accommodate more people. Going forward, you can see there's going to be more people knocking at your door, so you have to do renovation and then another renovation and so forth. So where does this fit? Can you remain the only rehabilitation hospital? Do we need more? Does the bell curve require that we rethink the scope and support, financial support for a hospital like yours?
Well, it's going to be a challenge. The baby boomer generation has reshaped pretty much every aspect of American society, and depending on their age, everywhere from the success of companies like Disney to Nike, Disco, Starbucks, SUVs, and now the growing consumer demand is going to be for healthcare services. Now, the number that sticks in my mind is that in Hawaii by year 2030, 23% of Hawaii's population is going to be 65 or older. And the data shows that patients 65 or older tend to require more healthcare services. So we know that this is coming. This as they call it, the pig going through the python. This bulge is coming, and we need to prepare for it. Part of the challenge of that is the baby boomers are the most demanding consumers that American society has ever met.
Why is that? Do we know why that is?
Partly just the size of the demographic. I think because it is a well-educated group. At the same time that the baby boomers are coming through society, you saw these huge increases in the number of people getting college degrees. They fueled the growth of companies, like Apple and Starbucks, as I said. Just a lot of different factors, but they tend to be very knowledgeable, very demanding consumers. They're not afraid of going on the internet and finding out how things are done elsewhere, what's best, and then demanding that.
Including as patients.
That's right. And so we need to be able to respond to that. Part of our renovation was simply to make the hospital more approachable, more customer service oriented. Some of the areas that we brought in were specific for that. The other challenge is that, as the baby boomer generation gets older, the demands on Medicare in particular are going to grow, which means that we're going to need to change how we provide services. And as this demand is increasing, at the same time, there are ways being developed, and rehab is developing these as well, in providing services at other levels of care rather than on an inpatient basis. Inpatient care is very important, and for many patients it is absolutely necessary, but we are looking at how we can provide certain levels of care at other levels, on an ambulatory basis. And what we need to do to change how we provide that care to make sure that our patients are still getting the results they need, and yet having a smaller cost impact on the system as a whole. As this generation is moving into the healthcare systems, there will be a lot of demand placed in the systems.
And this kind of hospital becomes relatively more important in our lives.
Well, I think that's true, and when you look at the changes that have occurred in healthcare as a whole, there's less of an emphasis on inpatient care, more of an emphasis on outpatient care, and so we're in what they call the post-acute environment. We're downstream from the acute care hospitals, and so they will be sending more patients to us, and we're going to need to work with the acute care hospitals in partnership to help to manage the patients and to give the outcomes that we need. But I can guarantee you, the healthcare now is not like it was when I first started 20-something years ago, and 20 years from now, it will be different again still. It's an industry that's constantly having to reinvent itself to meet the needs of the patients. And I have no doubt that Rehab Hospital will be capable of reinventing itself, of expanding its services, of redefining how these services are provided in order to meet the patient's needs.
Wow. Thank you very much, Dr. Rowe.
Well, thank you. It's a pleasure being here.
Great to talk with you. That's Dr. Timothy Rowe, CEO, President of the Rehabilitation Hospital of the Pacific. We have learned so much today. We know a lot more about this hospital and other rehabilitation hospitals than ever before. Here on Community Matters, Hawaii's Rehabilitation Hospital. Mahalo.
Great. Mahalo.